If you want to get a COVID shot this year, you might want to check to see if you are in the group of people who have federal approval to get this vaccine. Virtual at 6, John Chapman tells us the FDA only gave the green light to some.
If you're 65 or older or a child or adult with at least one medical condition, go ahead, roll up your sleeve, and get your protection from COVID. But this year, not everyone is recommended to get a COVID shot.
I think that's unfortunate and certainly not backed by the data and science that's out there. So what the data will show is that the vaccine is safe for all ages from 6 months up, and we've given now billions of doses of these vaccines worldwide.
Dr. James Lawler is professor of infectious diseases and an associate director with the Global Center for Health Security. Dr. Lawler says vaccines work best when they're broadly applied across a population.
So vaccines do protect the individual, but they also protect us as a community by reducing disease transmission.
There will definitely be enough shots for those that want it and need it.
Andrew Sliceman is a pharmacist with Kohl's Pharmacy. He tells us they have administered 100 to 150,000 COVID shots during the age of COVID. He says his pharmacy always has enough vaccine.
We're just very aggressive with it. We know the importance that it is for the community, and we put a very high priority on that.
While Kohl's expects to have enough COVID vaccine, paying for the shot will depend on CDC recommendations, and those recommendations determine if insurance will cover the shot. And if you're not recommended by the government to get the vaccine, you might have to pay for it. Sliceman says there's another way to help your insurance pay for the $100 to $150 shot.
Just like any other medication, a doctor can prescribe it off-label. So if a patient is in communication with their doctor, even if they aren't classically eligible and they think, hey, they'll be a good candidate for it, that doctor can prescribe the vaccine for them.
Medical officials expect the turnout for COVID shots will be lower this year. That could be sparked by misinformation about the vaccine.
It's incredibly dangerous, and it's not only dangerous with respect to COVID. We're still seeing thousands and thousands of COVID deaths a month, even at low times, and now with the summer surge, we're going to see more.
Dr. Lawler stresses that vaccines are safe, and he believes other diseases have once again become an issue because of all the misinformation out there about vaccines.
And honestly, disinformation, much of it is intentional, and that creates skepticism for vaccines that we've been using for decades that are preventing diseases like measles and chickenpox and diphtheria.
In Omaha, I'm John Chapman, First Alert 6.
CVS is limiting their COVID-19 vaccine distribution this fall. The National Pharmacy will not provide the shots to residents at all in 3 states. In 13 others, they will require a prescription depending on the patient's age. Here in Nebraska and Iowa, you won't need to worry about any changes at the pharmacy. CVS follows state-level regulations. In some states, pharmacists are not allowed to give vaccines that are not recommended by the Centers for Disease Control and Prevention. Vaccine advisors to the CDC are scheduled to meet next month.